Hello students, my name is Liz Attia and today's topic is principle-based ethics. Okay, so what is principle-based ethics? Well, it's the main approach to ethical decision making in the health system, and it's based on a series of 4 principles. They are autonomy, beneficence, non-maleficence, and justice. In terms of an overall snapshot, let's just talk through that fairly quickly now. We do come back and revisit these principles in a lot more detail. What autonomy gets to is the idea that people should be allowed to make their own decisions. They're the boss of themselves, if you like, and they have the right to actually enjoy decision-making in relation to their own person without interference and without coercion. Beneficence, the idea that people should be altruistic and give care to others. I guess in a snapshot, what we're talking about in beneficence is the idea of doing good. Non-maleficence, which is the idea of people doing no harm. And you can see that beneficence and non-maleficence are 2 sides of the same coin. One is proactive in action, that is doing good, and the other is refraining from harm, which is non-action. And then the idea of justice. So the concept that goods and services should be allocated fairly, based on need, not based on equity. And we come back and we discuss that in a few lectures' time. So what does this mean in practice? How is this behaviour and how does this influence behaviour and how are these principles seen? Well, autonomy requires practitioners to respect the rights of their patients, to make their own decisions in accordance with their own values. So it's the idea of respecting the right of the patient to make a decision, even if that contravenes a social norm, even if it contravenes a standard of the organisation or the agency, even if it actually is at odds with the practitioner's own ethical standard and ethical basis. It allows competent patients to be informed and maintain control over the decisions that affect their health. Now, I'll just point out to you at this time, and we go back and revisit this concept later, but the idea of competent patients, because both legally and ethically that has particular meaning. It ensures that the decisions made by patients are voluntary and based on adequate information and discussion. So if we're actually saying that individuals and clients and patients have the right to make their own decision in respect to their own values, we need to ensure that they have adequate information and are supported through that decision-making process. And at the end, the decision is free from coercion, from duress, from manipulation, and from misinformation. And in ensuring autonomy in practice, the practitioner is upholding the trust and the confidentiality of their client and patient. So that goes to the trust relationship between practitioner and client. Okay, the second principle is beneficence. So in terms of a working definition, I'd refer you back to the textbook on page 87. Active well-doing, altruism or conduct aimed at the good and well-being of others. So it's in the interests of your client and your patient. It's in their interests that you're doing good. How is this manifested again in practice? Well, it's above all to value curing, to value helping, to value healing. Now, just have a think about that in terms of the practice implications there, because I'd ask you, I guess, to consider whether the idea of doing well necessarily means curing, helping, or healing. But just keep that in mind for now. It's about the practitioner being competent and recognising the limits of their own competence. So the idea is there is some insight and awareness into your own practice as a health professional and knowing what the limits and the boundaries and the constraints of your practice might be in the interests of your patient. And also analysing and evaluating risks and benefits associated with treatment. So that's the idea of, yes, valuing curing, helping and healing, but also managing risk and assessing the risk. So it's not help, healing and curing at the cost of the associated risk with the treatment. Now, some people would actually argue that beneficence includes consideration of the well-being of all and not just the individual. So some take a bird's eye view in terms of which particular stakeholders are considered in this idea of doing good and promoting the well-being of others. Is it just the client? Is it just the patient? Is it the health agency? Or is it, in fact, public health and a population health viewpoint there? Okay, so the next concept in terms of the principles is non-maleficence, the idea, and I won't try to actually say the Latin, as the first concern to do no harm. And again, in practice, what this might mean is that the practitioner refrains from any behaviour which may cause a patient any harm. Once again, I'd ask you whether that's completely possible or not. Just consider that. To avoid any deliberate act which may be detrimental to a patient, including disregarding the wishes of the patient or having insufficient skills for treatment. And you'll see that that actually marries well with the idea of beneficence, because we talked about competence as a practitioner in the previous slide. Avoiding emotional, physical, verbal or sexual abuse, clearly including psychological harm, refraining from treatment if the practitioner function is impaired, and there are in fact quite a number of legal cases in your textbook which revisit this particular issue as it goes to the competence of the practitioner at the time and whether that, based on the principle of non-maleficence, was warranted or not. But we'll talk about that in a few lectures. And then I guess the general idea that non-maleficence and medical negligence are often related. The idea that clearly in doing harm and causing damage, you're breaching the principle of non-maleficence. Okay, and then the last principle is that idea of justice, which is more of a bird's eye view around the allocation of resources and services. So it's standard and expectations which any society holds concerning relations between members of that society, their rights and services that are due to any member of that society, and it's about fairness, rightness and equity. So it imposes a duty on healthcare practitioners to act fairly and justly towards their clients. It involves equality of treatment and non-discrimination, and human rights are clearly implicated in this principle, remembering that there you're actually talking about allocation of services and resources as well. So what we're talking about in terms of, I guess, the human rights aspect is that each person has equal dignity and worth, and each person or group can make justifiable claims to things like treatment and welfare based on this equal dignity and worth. So it's about access to services. And each person should demand or receive a minimum standard of treatment and respect. So the fact that we're all human beings brings with it the right for good healthcare practice and access to services, and that's based on the principle of justice, that this goes to our fundamental human right to ensure that with dignity and based on welfare, we have the claim to access quality healthcare services. Thank you, students. That brings today's topic to an end.